So last time we were studying about some of the bones in relation to the lower limb. आज हम today we are going to not only going to do the bones, but I will also try to cover the muscles also. Okay. So we will start from this diagram now. So when we start our lower limb, I tell to you what, okay, bhai, you have to take all the muscles according to the region. Okay. So this is our thigh region now. And in relation to thigh region, please remember that we must have to study first of all the gluteal region muscles because they are very important in relation to hip joint. Okay. क्योंकि हिप जॉइंट पे आपकी मूवमेंट्स होंगी देयर विल बी एक्सटेंशन मूव देयर विल बी flexion movements and you must have to know which muscles are in relation to extension and flexion. Okay, so first of all see this diagram now. So this is our this point, this is our anterior superior iliac spine. So this anterior superior iliac spine, it is at a ligament is attaching here with the pubic tubercle. Okay, so you have a pubic tubercle, and this pubic tubercle, this ligament is attaching, which I am highlighting in the red color. This one. This ligament is known as inguinal ligament. Number 1 point. First of all, tell me how the inguinal ligament is formed. Write down in the chat box. Jaldi. How the inguinal ligament is formed. Very good. It is formed by the external oblique muscle. नहीं लिखेंगे शाहजेब. It is formed by the aponeurosis of the external oblique muscle. Yes, this will be the correct answer. Yes. So आपके ये these are the muscle fibers, and now the muscle fibers are going upward like this. So this is your inguinal ligament, and here it is forming a canal in which your structures are present. Uh, Okay, so structures are present. So these structures which are passing through the inguinal canal, okay. So this is your inguinal ligament now. Okay. So inguinal ligament, it is formed by the aponeurosis of your external oblique muscle. पहला point. Now see here. Now this ये जो अभी आप diagram देख रहे हो, in this diagram you are seeing the anterior compartment of the thigh. Okay, anterior compartment of the thigh. Okay, and if you see the anterior compartment of the thigh, first of all you must have to see this muscle fibers are coming out. Okay, I will make it in blue color. So these muscle fibers are coming out, and now it is going downward like this, like this. So it is this muscle is known as sartorius muscle. Okay, इसका क्या नाम है? This is the sartorius muscle. Please remember, sartorius muscle, it is the longest muscle of your body. ये आपको पहला पॉइंट पता होना चाहिए. It is the longest muscle of your body, and this sartorius muscle, uh, it is passing through the hip joint anteriorly. Not largest muscle. Largest muscle is your gluteus maximus. लार्जेस्ट मसल इज ग्लूटियस मैक्सिमस, जिस पे आप बैठे हुए हो. लार्जेस्ट मसल इज ग्लूटियस मैक्सिमस, लॉन्गेस्ट मसल इज सर्टोरियस. Okay, now see here, this sartorius muscle originating from anterior superior iliac spine. This is your anterior superior iliac spine. Okay, so from anterior iliac spine, it is going down here, down, and now it is attaching here to the medial surface of the shaft of your tibia bone. ओके, सो दिस इज द sartorius मसल. अब मैं आपको बताऊंगा व्हाई आई एम टॉकिंग अबाउट दिस sartorius मसल. ओके, बट एट द मोमेंट जस्ट रिमेंबर दिस इज द sartorius मसल and this is the longest muscle of your body. Second muscle which you must have to see here, second muscle, that is your adductor muscle. In the diagram you can see this muscle here, this muscle. So this muscle fiber is known as your adductor longus muscle. Okay, which muscle? Adductor longus muscle. So adductor longus muscle, see here now, all students. Adductor longus muscle along with your uh, one second. Adductor longus muscle along with your sartorius muscle and the inguinal ligament, it is making here this triangle. This triangle is known as femoral triangle. Very, very important. This is your femoral triangle. Triangle. मैंने triangle की spelling ही गलत लिखी. This is your femoral triangle. Okay. So why this femoral triangle is important? Number one thing. पहले आपको पता होना चाहिए कि what structures are forming the femoral triangle. The femoral triangle, superiorly it is formed by the inguinal ligament. Laterally it is formed by the sartorius muscle, this one. And medially it is formed by the adductor longus muscle. मीर आलम सर को देख के तो मुझे खुद ठंड लगना शुरू हो जाती है यार, इतनी भी ठंड नहीं है. So these three structures are making here a triangle that is known as femoral triangle. And now see here, some structures are passing through the femoral triangle. And mnemonic is NAV, NAV. So first structure is femoral nerve. हाँ, बिल्कुल सही कहा. First structure is femoral nerve. Second structure is femoral artery. And third most structure is your femoral vein. Okay, so this is your femoral vein. Okay, so femoral artery, femoral vein, and femoral nerve. These three things are the contents of your femoral triangle. Okay, they are the contents of femoral triangle. So this femoral triangle is very important because under this, see here, this is your femoral triangle like this. Okay, this is your adductor longus muscle, this one, and now it is opening here into this canal. Okay, this canal is known as adductor canal. Adductor canal. Okay, so this femoral triangle, it is opening into the adductor canal, and this adductor canal is going downward, and now it is also having it joining with your this popliteal fossa. Popliteal fossa. Okay, now this femoral triangle is important now. So first of all, यहाँ पे मैंने आपको इस डायग्राम पे बताया. Now we will make our own diagram. Now see here everyone, all students. Number one, this is your beautiful thigh. Thigh तो आप सब लोगों को अच्छा ही पता होगा. Something like that. ज्यादा ही वो हो गई. Okay, चल, no problem. Now see here everyone. This is your anterior superior iliac spine. This is your pubic tubercle. अभी gluteus maximus भी बताऊंगा. Pubic tubercle. And now here a ligament is present. This ligament is known as inguinal ligament. Draw this diagram with me, all students. Now one muscle is coming out from here, like this. Okay? So muscle fibers are coming out here like this. This is the longest muscle of your body, and this is known as sartorius muscle. It is originating from the anterior superior iliac spine, and now it is attaching to the medial side of your what? Tibia bone. Okay, sartorius muscle. Second muscle is present here, this muscle. This muscle is known as adductor longus muscle. Which muscle? Adductor longus muscle. Now this triangle is forming here. So this triangle is known as what? This is known as femoral triangle. This is your femoral triangle. Now what structures are present here? See here everyone. Number one, this is your femoral nerve. Number two, this is your femoral artery. Number three, this is your femoral vein. So mnemonic is NAV. Femoral artery, femoral vein, and femoral nerve. So these are the contents of your femoral triangle. And under this sartorius muscle, here there is an opening for a canal. That canal is known as adductor canal. Adductor canal. बता देते हैं बता देते हैं बता देते हैं Don't need to worry. Now see here. This is femoral vein, femoral artery, femoral nerve. These are the contents of your femoral triangle. Number one point which you must have to remember. Second important point. This femoral artery and femoral vein, they are present in a sheet that is known as femoral sheet. Yeah. So please remember, femoral sheet. This is your MCQ. Femoral sheet contain femoral artery. Femoral sheet contain femoral vein. But femoral sheet do not contain what? Femoral nerve. This is your MCQ. और यहाँ पे there is a femoral ring now. This is femoral ring. Okay. So these are the structures which you must have to remember. But if I take a cross section of femoral sheet, okay, if I take a cross section of femoral sheet, एडक्टर कैनाल पे भी आता हूँ आर्यन प्लीज वेट पहले ये फेमोरल ट्रायंगल तो मुका लें then I come to adductor canal. Now see here, this femoral sheet, it contains femoral artery, it contains femoral nerve. So if I draw here the femoral sheet like this is our femoral sheet now. Now I can divide the femoral sheet also into three compartments. The lateral compartment, the intermediate compartment, and this one is the what? The most medial compartment. Okay? Lateral compartment contains, if this is the femoral sheet, lymphatics पे भी आ रहा हूँ. I am coming to lymphatics. Bilal, I am coming to lymphatics. See here. If this is the femoral sheet, this is your what? This is your femoral nerve. So it is outside the femoral sheet. Number one point. Okay, this is femoral nerve which is outside the femoral sheath. Okay, now what is present in the lateral part of the femoral sheath? Answer is this. This structure is present. What is this structure? This is femoral artery. What is this? Femoral artery. What is present in the intermediate structure or intermediate part of the femoral sheath? Answer is femoral vein. Femoral vein. Okay. And in the medial part of the femoral sheath, you have here the lymph nodes. These lymph nodes are known as what? Lymph nodes of Rosenmuller और क्लॉकेट. ये आ गए जी आपके lymph nodes बिलाल. So lymph nodes of Rosenmuller or Cloquet, they are present in the medial part of your femoral sheath. Clear to everyone? This is clear to everyone. अब यहाँ पे एक और MCQ है. In this lateral part of the femoral sheath where femoral artery is present, one nerve is also present here. Nerve आ गई जी एक. So what is this nerve? This is the femoral branch of genitofemoral nerve. This is your MCQ. So genitofemoral nerve, it is giving two branches. One branch, that is the genital branch. Second is the femoral branch. So femoral branch of genitofemoral nerve, it is present in the femoral sheath, not the femoral nerve. Femoral nerve is outside the femoral sheath. It is clear to everyone. This is clear to everyone. So once again, I am telling to all of you, see here. This is clear. So this is your inguinal ligament. This is the adductor longus muscle. Yes, sir. Okay. This is the sartorius muscle. Sartorius muscle. And this triangle which is forming, this is known as what? This is your femoral triangle. Okay. And in this femoral triangle, you have femoral nerve, femoral artery, femoral vein, and some lymph nodes of Rosenmuller or Cloquet. Okay. Now, femoral nerve, it is not a content of your femoral sheath. Femoral sheath is covering the femoral artery and femoral vein, and it also contain a nerve. What is the name of this nerve? This is the femoral branch of genitofemoral nerve. This is your MCQ, which you are going to make mistake. Okay? तो ये आपका MCQ है. So this is your what? Femoral triangle. Now see here. This femoral triangle base is formed by some muscles. Now I am stopping. This is done now. So now I am coming back to our atlas. So now base of the femoral triangle, it is formed here by some muscles. What are the name of the muscles? See here everyone. It is formed here by this muscle. So this is which I am highlighting at the moment in blue color. This is your femoral triangle. So this is your femoral triangle. So base of the femoral triangle, बिल्कुल inguinal तो ऊपर है भाई. Inguinal ring is here. Above the inguinal ligament is your inguinal ring. इधर तो नहीं होगा नीचे. क्या हो गया तुम लोगों को? यहाँ पे आपका होगा deep inguinal ring, and here there will be your superficial inguinal ring. Okay, femoral is here. This is your femoral ring below the inguinal ligament. Okay. So see here, this femoral triangle, its base is formed by this muscle. What is this muscle? This is your iliacus muscle. Iliacus muscle. Iliacus muscle. This is your psoas major muscle. इन दोनों को हम लिख सकते हैं इलियोसोआस मसल. And then it is also formed by the fibers of this muscle. This is known as pectineus muscle. So base of the femoral triangle, it is formed by iliopsoas muscle. It is formed by pectineus muscle. It is formed by some fibers of your adductor longus muscle also. Okay. So this is your whole what? This is your whole femoral triangle. And what are the contents of femoral triangle? Femoral artery, femoral vein, and femoral nerve. Clear to everyone? Now this femoral triangle, see here everyone, it is now opening into this canal. This canal is known as what? This is known as adductor canal. This one. So this is your adductor canal. Okay? Adductor canal. So adductor canal is what? It is your intermuscular, you can say canal, which is present in the middle, or you can say middle 1/3 of the thigh. Middle 1/3 of the thigh. It is present in the middle 1/3 of the thigh. Okay? It is present in the middle 1/3 of the thigh. And which structures are present in your adductor canal? In your adductor canal, you have femoral artery, you have femoral vein, and you have saphenous nerve. This is your MCQ. Saphenous nerve. It is a branch of your femoral nerve. Okay. Femoral nerve is going to give branches and then it is going to continue as the femoral nerve. So this is femoral artery, femoral vein, and saphenous nerve. It is the content of your adductor canal. Okay. This is content of your what? Adductor canal. And this adductor canal, see here, it is going to, for example, if this is the femoral triangle, the adductor canal will be opening here like this. And this canal is going to open here with this popliteal fossa, which is present behind your what? Behind your knee region. Okay, which is popliteal fossa is what? It is a diamond shaped structure present at the back of your knee. So in this adductor canal, what is present? Femoral artery, femoral vein, and saphenous nerve. This is your MCQ. Saphenous nerve, it is the content of your adductor canal. And in the popliteal fossa, this is your popliteal fossa behind. ये तो मैंने आगे बना दिया. It must be present behind the or at the back of your knee region. It contains what? It contains popliteal artery. It contains popliteal vein, and it contains what? Tibial nerve. Tibial nerve, which is a component of your sciatic nerve. Component of your sciatic nerve. So these contents are very, very important for your exam. And this adductor canal, this is also known as sartorial canal because it is present under your sartorius muscle here. Sartorius muscle के बिल्कुल नीचे there is a canal present है, that way it is known as subsartorial canal. And by author name it is also known as Hunter's canal by author name. Okay. So these are the important points in relation to your femoral triangle, adductor canal, and your popliteal fossa. So see here, Femoral triangle, it is present in the upper 1/3 of thigh. First point. Adductor canal, it is present in the middle 1/3 of the thigh. Popliteal fossa, it is present in the lower 1/3 of the thigh. Okay, it is present in the lower 1/3 of the thigh. So you must have to remember these contents. Very, very important. And 1 or 2 MCQs will be from here. Clear to everyone? This is clear? Okay. Now see here other important points. Yes, sir. Okay. So this is your anterior compartment of the thigh. Okay. But before going into the anterior compartment of the thigh, I must have to show you the muscles of the gluteal region. Yes, popliteal fossa in lower 1/3 of the thigh. Here, this is the popliteal fossa. So see here, you must have to know the muscles of the gluteal region. Okay, because they are going to help you in hip flexion and hip extension. Now see here, अब यहाँ पे बहुत ज्यादा मसल्स हैं. इतने मसल है आप लोग परेशान हो जाओगे यार, इतने मसल हम कैसे याद करेंगे. तो ये देखें, sartorius muscle, it is present in the anterior, you can say anterior part of your thigh. Gluteus maximus muscle, it is the largest muscle of your body. This is the largest muscle, not sartorius. Sartorius, it is the longest muscle of your body. Longest muscle, sartorius. Largest muscle, gluteus maximus. Okay. So there is a rule in anatomy. If any muscle is crossing the hip joint anteriorly, if any muscle it is crossing the hip joint anteriorly, it will pull the femur bone anteriorly. And if it is going to pull the femur bone anteriorly, it will cause hip flexion. So gluteus maximum, it is present crossing the hip joint posteriorly. So if it is going to cross the hip joint posteriorly, it will pull the femur posterior. So when it is going to pull the femur posterior, it will cause what? Hip extension. It will cause what? Hip extension. Your iliopsoas muscle here. Iliopsoas muscle, it is also present anteriorly. So it will also cause what? Hip flexion. Okay. Now see here. Gluteus maximus. Please remember very important point. It is the chief muscle of your hip extension. Chief muscle of hip extension, your answer is gluteus maximus. This is the chief muscle of your hip extension. The chief muscle of your hip flexion, it is your iliopsoas muscle. Iliopsoas muscle. Clear to everyone? Now see here. In hip extension, these muscles are present. ये वाले, नीचे वाले, these muscles. So along with gluteus maximum, your hamstring muscles are going to help you in hip extension. In hip flexion, along with iliopsoas muscle, sartorius muscle, and your this muscle, rectus femoris, and your pectineus muscle, which are present here anteriorly, जो मैंने आपको अभी डायग्राम में दिखाया था. They are your chief muscles of hip flexion. Clear to everyone? This is clear to everyone? Okay. तो देखें, hip extension is done by which muscle? It is chiefly done by your this gluteus maximum muscle. Hip flexion, it is chiefly done by your iliopsoas muscle. So main hip extensor is gluteus maximus. main hip flexor is iliopsoas muscle. Okay, but if it is, okay, so hip flexion, hip extension. Clear? This is clear to everyone. This is clear to everyone. So rectus femoris, it is present here in the anterior compartment of the thigh. So when it is present in the anterior compartment of the thigh, it will help the iliopsoas muscle for hip फ्लेक्शन. तो अगर यहाँ पे मैं आप लोगों को एक बड़ा ही इजी सिंपल चीज बता दूं, तो दिस इज द एंटीरियर कंपार्टमेंट ऑफ द थाई, दिस इज द पोस्टीरियर कंपार्टमेंट ऑफ द थाई. So if it is helping in hip flexion, it is going to help you in knee extension. उल्टा कर दो. If it is going to help you, the gluteus maximus in hip extension, so the posterior compartment muscle, they are going to help you in knee flexion. Clear to everyone? Clear to everyone? So if I am going to ask you, if I am going to ask you, anterior compartment of the thigh, आप लिखोगे मुझे सर anterior compartment of the thigh, it is going to help in hip flexion and knee extension. If I am going to ask you posterior compartment of the thigh, आप कहोगे it will assist the gluteus maximum in hip extension and it will help you in knee extension. Clear to everyone? Knee flexion, sorry, knee flexion. Clear to everyone? Till now everything is clear? एक मिनट रह गया.